Afternoon, everybody. I'm going to go ahead and call the meeting to order. And I'd like to welcome you to the first day of winter here, or at least what appears to be winter. Welcome you to the Coeur d'Alene School District Special Board meeting for October 23rd. Before we get going, just want to introduce our participants up front here. My name is Casey Morserow, and I'm the board chair. To my right is Rebecca Smith and Lisa May. And behind them is Lynn Town, our board clerk. To my left is Jennifer Brumley, our vice chair. And on the phone today, she wasn't able to be here in person, is Tambra Pickford. And then Dr. Steve Cook, our superintendent. We'll have no public comment today, but comment can be submitted through the clerk or sent to our new trustees@cdaschools.org email address. And that appears to be catching on because we had lots of emails through it today. Okay, is there a motion to approve today's agenda?
Second.
Okay, thank you. It's been moved and seconded. All in favor?
Aye.
Aye.
Aye. Okay, thank you. Agenda is approved. We'll move on to our information action item today, and that is the change by Panhandle Health District yesterday of their schools county risk level assessment. They moved it from orange to red, right? Orange to red. And so I'm going to turn over to Dr. Cook, but before I do that, I just want to clarify, we've had lots of emails today about mask and the district's mask policy and where that stands based on the action taken by Panhandle Health yesterday. And so I just want to clarify, the district's mask policy is independent of the Panhandle Health mandate that they had in place, and really, our policy is still in effect. I just want to make sure that we're all in agreement that we're going to continue on with our mask policy as it is stated. Is that correct? Okay. So our mask policy will continue on as stated. Dr. Cook, I'll go ahead and turn it over to you for an update on Panhandle and why we're here. And really what we're doing, we are scheduled to meet next Monday. Excuse me. But we're really just taking any action we need to take today about what next week may look like. Really didn't want to sit on this over the weekend because we've had lots of comments, lots of questions, lots of concerns. What does red mean for our school district? And so we wanted to get that clarified before the weekend started. So Dr. Cook, go ahead, sir.
Thank you, Chair Morserow. I think the best place for me to start is reminding us what we talked about on Monday previously and this week. If you recall, we presented a modified proposal to our reopening plan to separate, if you will, K-8 schools from our high schools. Previously, a week ago today, there was a fairly substantial number of students and cases at the high school, and I took the liberty to move the high schools into orange, which is kind of this hybrid model, the AB model, that is students are splitting their time between remote 3 days a week and in school, in person 2 days a week in a kind of AB model. On Monday, you guys affirmed that action and additionally put into place the recommendation that we gave you was to move our schools in our K-8 schools into a different hybrid model, which was maximizing what we felt like was maximizing time and space for kids in classrooms and kind of giving some stability 4 days a week with Wednesdays functioning remotely for those students. Since that time, we've had a fairly substantial increase in cases. I shouldn't say fairly, a substantial increase in cases across the community, to the extent that Panhandle Health District on Thursday moved the community from the orange level category to the red level category. I was in contact with them today. They expect about 140 cases today in the region. That's the incident rate is in the between 35 and 40 range currently, which is fairly, as you well know, well into the red category for incidence rate. Percent positivity is hovering in about 17% range, which is also substantially higher than we're used to. The cut threshold for orange, I believe, is 8%, and their gating criteria for the red level on percent positivity is 20%. So it's, while that's not into the red, that is also the highest percent positivity that we've seen, I think, in our region to date. Another factor that I think is weighed heavily on, I don't want to speak for them, but they did say this, that was definitely a factor, was the rate of hospitalizations and the number of patients that are currently in the ICU, which is also at a high relative to the beginning of this pandemic. And I think for those reasons, they felt that it was necessary to move us into the red category, to move the community into the red category. And I think if you were to go back to our reopening plan and we were to strictly adhere to those decisions, then moving to red would be a natural next progression. And I think what we decided, and our team wanted to have consideration in, is, if you recall on Monday, we pled with you and the community that right now what we're hearing across our entire community in the schools and outside of the schools is, we've been in school since September 14th, and it's been a pendulum, and we're moving things all over the place, and transitions are happening everywhere we turn, and some stability would be much, much warranted and much, much rewarded. Just getting some level of continuity would be a tremendous benefit. And I've been to both of our high schools since we moved them into orange to just see how is that going. There is, I'll tell you, it's anecdotal, but there is definitely a sense of calm and a definite sense of resilience, and kind of almost like this makes sense to that extent. I've also been in several of our elementary schools. I spent 2 hours in Bryan yesterday talking with staff, and then spent some time in Woodland Middle School today. And I would tell you that there is definitely, it's kind of a tale of two worlds right now. There is definitely a difference in our high schools and in our middle schools and elementary schools. The K-8s just haven't had the amount of activity I think that we've seen at our high schools. And I think a positive case at our high schools has had a fairly substantial impact when those come about. And so I think one of the things I requested was an opportunity for us to meet today. You know, we had a scheduled meeting for Monday to talk about those next steps based upon Panhandle's decisions. However, this was a dramatic increase in the data and dramatic increase in activity in our community. And kind of just this, I think to some extent, I would still plea for some modicum of stability in our schools, and talk that through with you all, and maybe have that discussion with what those decisions might need, and what compromises perhaps we should make in some fashion, so that we can try to provide that to the extent that we can. We also very much recognize what we would consider as our responsibility to keep our kids safe, to keep our staff safe, but yet to meet the needs and expectations of our community, that we're also providing a learning experience for our kids, and what that looks like. So I think that's part of what I would suggest that this conversation maybe revolve around some today, and some of the things that we could potentially consider doing, and what those decisions might look like, and whether or not we can fulfill our commitment that we made on Monday to try to start in this newer model of hybrid, if you will, or newer model of orange for K-8, and perhaps leaving our high schools in that hybrid, and whether or not we want to consider a transition into red as it's currently in our reopening plan. One other thing I would add is, on Wednesday, the State Board of Education had a 9-hour board meeting in which they rescinded their reopening plan. And that's, if you recall, that was a plan that I also helped to create, so that they could change the parameters in which we would go to what I would consider a lockdown, what we call this kind of full-time 100% online learning. And the rationale that they report from that was that it was justified to rescind the full online to the extent that if the community is not going to shut down completely, that there's some effort to maintain some in-person presence in schools across the state to provide more flexibility. And I kind of almost this argument, if the bars and restaurants and businesses aren't closed, then are we doing the right service to our community by shutting down the schools, and to perhaps align those a little more. So there's a lot of moving factors that have happened in this last week that I think warrants a discussion today. And so I think that's probably a good place for me to stop. I've got a lot more things to talk about, but I want to do it in chunks, I do believe. So.
Okay, I think maybe before I just open up for questions or discussions, I think there's been, at least in the last 24 hours, a lot of questions or discussions amongst our community of, does red mean red? And does this mean the district's going to red? And are we closing our buildings? And so I think I have a general consensus of maybe where I think you all are at, but I would just maybe like to reaffirm what I think is that is not on the table for today. That we are not talking about going 100% online. Is that correct? Is that a fair assessment? Okay. And so, and Tambra, I'll do the play-by-play. It was all head nods here on the board. So I think we're in agreement. We're not looking at fully online at this point. So I think it's, okay, thank you. I think we really need to take up what Dr. Cook's asked of us. And are we wanting to forge ahead then with what we talked about and agreed to on Monday and settled on Monday? Or is there some middle ground, I guess, between that and hybrid? Or is it more hybrid than what we talked about on Monday? And so if you have questions, I would say to kind of start, let's go there and ask some questions. If Dr. Cook, if you have some additional information you wanted to present, then I would say it might be the appropriate time to do that after any initial questions or thoughts. So, initial questions, thoughts? Okay. You said you had something else or not really? I guess maybe I'll tee it up. I don't know what you have there, but we do have our extracurricular committee that I've sat on that's looked at our extracurricular activities. And really with this quick change, we weren't able to pull that committee together. We are scheduled to meet Monday afternoon, I believe, after our board meeting that we have scheduled for Monday. But I did ask that Assistant Superintendent Nichols kind of maybe give us some recommendations of some steps we could take, some extra precautions we could add in. And so I believe Dr. Cook probably has those for us.
I do. I actually have, and Dr. Roscoe is also here if you guys want to ask more detailed questions as well. But some of the things that we think should be in consideration are in congruence with what other regions and actually what other states are doing in some regards. First of all, it might be wise for us to start to limit group size at our activities. Maybe perhaps either eliminating spectators altogether or perhaps limiting them to a much smaller audience. For example, maybe you allow families to come, but doing our part to eliminate that. Maybe we do some eliminating or at least limiting, if you will, on things like field trips and outside activities that schools might still be participating in. We're right at the window in which winter sports are getting ready to start. It might be a good idea during this window of time that we do a pause on that. Maybe just say let's wait and see how this plays out. This is almost. I was on the call with the epidemiologists earlier today, and the data as the data comes in, it is evident that it is mirroring exactly what happened this summer, only to a higher extent. And so I think what we're trying to do is to provide as much opportunity for kids in schools as we can, while balancing the safety of the kids. And I would tell you that what we thought we knew back in March and what we thought we knew in July and what we know now is we are learning more, and we are actually finding out that there are things that we were a little nervous about in the beginning that we aren't quite as nervous about now, but there are also things that we're more nervous about now as we ebb and flow on this. And so I think there's some things that we can improve upon. We're talking about continuing to monitor, some of the things we can do with cohorting at the elementary level. Perhaps we can even limit some of the freedoms that we gave at that level, or we can decide that may not be a substantial contributor to the activity, the COVID activity that's going on in our elementary schools. And I think that's worthy of conversation. I know one of the things that we've done is to take in some time to evaluate the cases that are coming into our schools and are happening in our schools. And there is a difference at the levels. And so, one thing I would say is that it does appear that treating our schools as separate groups, if you will, high school activity, COVID activity is much more substantial than elementary and middle school COVID activity. I learned today that Boundary County has been moved to red, and I asked the epidemiologist, how many people are in Boundary County? And there's about 12,000 people in Boundary County. And when you think of our school community, between students and staff and adults that are in our schools, we're almost identical in size, just a few hundred students fewer, few hundred people fewer than all of Boundary County. And so that kind of led us to start doing some of our own math and looking and tracking that data. So I can tell you that right now in K-8, we have about 7,000, a little over 7,000, 7,500 students and staff. And we've had a total of 20 cases in those schools. All of those cases, minus one, from our research has come from the outside in, either bringing it from the families into the schools. That one case, we're pretty confident there was one case that we believe was transmitted in our schools. Currently in our high schools, 38 cases, excluding today, 38 cases in our high schools, of which we believe all of those also came in from the outside. And now that the high schools are in hybrid, we anticipate that the number of cases might still continue to be at that kind of steady pace, but we don't anticipate that we'll have near the number of students impacted by quarantining, because those kids are now much more capable of spreading out. And those class sizes, if you recall, that was the primary reason for removing those class sizes to split them to a hybrid level. And so for those reasons, those are some of the things that we feel like would be a responsible pathway forward for some changes that we would tighten up on a little bit right now, at least at the high school level. Kate, is there anything you want to add to elementary, or do you feel like I've captured it? Okay. And so let me just say that. Let me just say that for the people watching on YouTube, is that our ability to cohort at the elementary school, we're getting very, very good at it. We've been in schools now for, well, if you count the weekends, it's been 41 days since the first day of school. And we are learning and getting better at that as we go. And so therefore, as you would expect, the impact of positive cases is much, much less at the elementary school. And so this idea of perhaps a comprehensive approach, the way we approached it in the reopening plan, might be better served if we treated our schools a little bit differently. And I think on Monday we also mentioned that it might be wise for us to continue to watch school activity, COVID activity in each of our schools, in the light of if one school in particular has an outbreak or a number of cases in the school, that we could then target that school with maybe some additional interventions. So,
Dr. Cook, could you speak a little bit? We've had a lot of comment about concern if we were to stay with what we're doing right now about social distancing and just the complete, especially at the elementary
Yeah,
level.
of
Could
course.
you speak to that, please?
Yeah, there's really 4 strategies that we're recognizing are the most effective strategies that are your approach. The first one is some kind of shielding, in which we feel like the masks serve in that purpose. The second one is distancing and social distancing. Right now, those guidelines are that if you can stay 6 feet away, it greatly reduces your risk of contracting the virus. The third one is hand hygiene, and just doing what you can to keep your hands clean. And then the fourth one is a pretty rigorous cleaning environment, just cleaning surfaces quite a bit. And that's it. That's really the toolbox. And how well you handle those things are kind of what would be graded as the best measures of prevention that you can put in place. And so I think the next follow-up question is, at the high schools, we can provide a much better social distancing environment right now because half of our students are in school. At our middle schools and elementary schools, that wouldn't exist to the extent that it is at the high schools, because all of our students are in those schools. And I think that's the discussion that I'd love to know the board's position on, is what is that balance? When we believe, and it does appear, we're seeing some data, Dr. Lutz out of Spokane wrote to this specifically, and there's a lot of data now nationally that is starting to point to that schools don't necessarily seem to be super spreader type of environments. That being said, make no mistake, this is a real virus that can make people very, very sick and can actually kill people. But to the extent that middle school and elementary school students are socially distant when we're fully in class, that was the kind of the nature of, we were sacrificing to some extent some of that social distance in that idea of let's have all of them there 4 days a week, with that Wednesday kind of regroup day with the ability to clean and the remote learning piece for that, so that you get kind of that balancing. The sacrifice in that model is, we're saying that the risk is lower for those grade level and those ages of students, and therefore we can allow for them to be in that environment with less social distancing. If we do see that that's not going to be the case, then one of the things that we could do, and it could be done even today if that would be the will of the board, is to move them back to a hybrid model in which half the kids are there. Then you essentially guarantee social distancing. Doesn't guarantee that there won't still be positive cases, either in adults or the students, but what it does do is now reduce the risk between transmission, even more so for those younger grades as well.
Dr. Cook, I just had a quick question. I know when we started the conversation last week about stability, we've heard from parents over and over that this is an issue, pivoting back and forth between models. First, I'd like to affirm my commitment to keeping kids in school. I think we all recognize that it's exceedingly important, especially for our K-5 students, that instructional time is valuable. And this is not only a hardship for those afflicted with COVID-19, but it's for those families that have to work, and childcare is difficult. And so I think you're right. There is emerging evidence that K-5, we can be successful. And I'd like to applaud Dr. Orozco and her team for everything they've done as far as cohorting and class sizes. You've done a tremendous job. And, I was looking over the stats from this week, and it looks as though we had 2 cases at an elementary level with 4 students quarantined. At a middle school level, we had 4 students test positive, students or staff, resulting in 53 student quarantines. And so I guess my question is, last week when we began that conversation, I was very excited to hear you say, let's keep middle school in class 4 days a week. It's a move that I feel like that is also an at-risk population. They need instructional time also. What worries me after touring facilities last week is I witnessed numerous classrooms with large class sizes greater than 35. And Dr. Roscoe, maybe you could speak. I think at the elementary level, we've been lucky this year. We have a decreased enrollment, and so we've had room to spread our students out. And I believe our largest class size at elementary may be 26, and that might be rare, but I think we're doing better this year than we've done in years past. Is that correct?
That's correct. We do have some classrooms that are at 20. That's correct.
Right, no.
We do have some classrooms.
Sorry.
We do have some classrooms that are at 28, 29, but that's not the norm like it usually is. So we do have fewer numbers, and frankly, the e-school itself has had an impact on our elementary schools in terms of spreading those numbers a little bit.
Yeah, and another difference I think is important that we talk about that's changed from last week is that we're able to cohort our elementary students. So every class is staying together throughout the day. I know we've made some changes as far as art and music, but primarily speaking, you guys are able to determine, who's been in close contact with an individual, and you're able to isolate that person and move forward. I worry at the middle school level, and I don't know who's here to speak for the middle school, and maybe you can for them. Are we doing any cohorting? Is it possible to reduce class size if we want to keep in that model so we don't have students sitting shoulder to shoulder? Rebecca and I did some tours, and it was a little bit alarming even last week, but now knowing the amount of community spread that we have of COVID-19 in our community and a positivity rate approaching 18%, it is likely that we're going to continue to see cases, and I worry that we're going to result in numerous students quarantined. I mean, looking at the difference between 4 elementary students quarantined to 53 in 1 week is a dramatic difference, and I worry about the instructional time lost for those students who end up being quarantined. And so I wonder, while we're working to reduce the trajectory of this disease like we did in July, that considering that maybe now is not the time to lump K together, that we recognize that K-5, we have something special that's working. We're cohorting, we're socially distancing to the best of our ability, and we can locate, contact trace, and keep those students in class. Middle school, I think it's going to be difficult, and so I guess I would ask either we change our approach and how we're, if we could cohort those students, if that's not possible, are there facilities where we could spread these kids out so they're not sitting shoulder to shoulder, and we could socially distance, and so not as many students would be affected by a positive case in the classroom. And then lastly, I know we're maybe going to talk to this Monday, but I see Nicole sitting over there, and I would just love her insight because she's a great resource for our district. But now that the CDC has changed guidelines as far as what constitutes an exposure, I worry about our middle school students sitting shoulder to shoulder in a tight classroom. And will that be more difficult for our staff if we're now having to look through 6 periods of 1 positive student and adding up minutes of time? And I think if we were able to reduce class size and potentially move to a hybrid, we could have more instructional time for all of our students, and it might be easier on staff. So I don't know who wants to take which question first, but it's just been on my mind this week since things changed so dramatically.
You want to go first?
I can tell you, I had a middle school principal text there while you were speaking, say it would be very challenging to either reduce, to spread the kids out when they're all there, or cohorting would essentially take a complete changing of the schedule.
I thought they might
So.
say that.
Chair Marisro, members of the board, Superintendent Cook. Regarding the timing component of close contact and the definition of it, what we found out this week is that they would like us to calculate the exposure over 24 hours. I shouldn't say calculate the exposure, but consider the exposure over 24 hours. And we have considered that, and we feel like the greatest impact to the school district would actually be to activities, and we anticipate discussing that on Monday when the extracurricular committee meets. Regarding classroom exposures, it's true we would not have the capability of tallying exposure minutes, adding up 1 minute, 2 minute, 3 minutes. I think if we look at the intent of this definition change, we would be capturing, like I said, the change for us would be perhaps like in a 1 hour athletics practice where we've had 7-minute drills. And now we see that over an hour, that constitutes 15 minutes in 24 hours. But as for classroom exposures, we've talked about this briefly, and it seems that we would probably follow the same practice we have been following regarding classroom exposures or other in-school exposures, because we haven't been limiting the time to that 7-minute or 10-minute activity like we have been for athletics.
Trustee May, I would just add, anytime there is a transition, and when you talk about middle schools, you're talking about a transition between classes, then that positive case will then be now in a new group. And so those numbers, while that is just the rational, the way that kind of almost like that math problem works out. So it would not be atypical for every positive case in the middle schools, if we're in this kind of different model of Orange, to continue to push out some number of students that is substantially different than the way it's being administered at the elementary school. And I think that's a very real concern that we've discussed as well. That being said, the trade-off is, you've got, for example, let's use those 54 kids that are now in quarantine. They're participating remotely, and they would be remote for the next 14 days, or however we would administer that, if that were to ever change, which is also a consideration. But those kids are now participating remotely. If we go to a hybrid model, for example, at the middle school, now half of the students are participating remotely for 3 days every week. And so it's not that I disagree by any means. I think that's a very astute observation, and it is the challenge that we have in balancing what are those educational opportunities. I went to Woodland Middle School today and just asked teachers, how's it going? And they're struggling because their struggle is these kids, we're finally starting to get into a groove. We've been in, 3 weeks now, we've had 5-day-a-week school for them, and that decision, and they none of them were frustrated with us or the circumstances. They were like, it's the first time I've actually made some headway with some of our students, and some of their F list, if you will, or whatever. They said there's so much work left to be done. And so I think there's what is the trade-off? And I think that's the balance that we're seeking. And your question is exactly the question, which is the risk in having that number of students quarantined and exposed potentially to positive cases and then being sent out of the school, is that acceptable or is it not? And is the cost of the missed learning opportunities or the reduction in the learning experiences from face-to-face to online, is that worth that conversation? We don't currently have an ability or a location in which we could take those students and spread them out so that every kid is 6 feet from every other kid. It just, those resources, I guess we could move some things, the fairgrounds maybe, but that's not, now we're talking ventilation and horse barns, right? And so it's just, I think that's the challenge, so.
And I think the point in me asking is that, when we toured, there were some teachers that were worried that the quarters were tight and class sizes are large at the middle school, consistently large. And so I worry if our resources to prevent, combat, change the trajectory of this disease process are through masking, social distancing, ventilation, hand washing, cohorting. We can't effectively do that at the middle school right now, and in any of our classrooms. And so we're pivoting now to red in 1 week. And so before we make it a move at middle school, I just want to explore, is it the right move to say we're going 4 days a week, or do we need to say middle school is more like high school? And honestly, it probably is. Our K-5 is cohorted. They're functioning in their own not world, but their own pattern. They've been successful. Their cases have been low. The quarantine numbers have been low. Middle school's on a different trajectory, and we're seeing more cases and we're seeing more quarantines. And so I wonder if we commit to 4 days a week starting Monday and we see a spike in cases at a middle school, is it going to be more disruptive to the staff and students if we have to pivot again like we did at high school to the hybrid? When we toured at the very beginning of the year and saw the middle schools in a hybrid model at Lakes, we got really positive feedback that the teachers were able to have more interaction with their staff, and they felt safe and they felt as though it was working. So I want to have a conversation about how do we prevent too many transitions. We've made a commitment to this community on a plan that we're no longer following because we recognize that much has changed in the in COVID-19 over the last 8 to 9 months. But by not doing one of the key items that we keep hearing about, and that's social distancing at middle school, are we missing an opportunity to really do our part? And so I just wanted to hear what my fellow board members felt about that.
Well, I have a question related to that then. Dr. Cook, you talked about Monday, and the discussions of going to the 4 days with the elementary and meeting or speaking with our middle school administration, and them coming to you essentially and saying, put us in that 4-day week. I assume, but maybe wrongly, that they knew they could have certainly argued or asked for a hybrid model. And so I guess my question is, I want to make sure I have a clear understanding of what those administrators were asking for as I process this.
Yeah, that's exactly the way I approached them was we think this might make sense even at the middle school level as well, while the cohorting that's happening at the elementary is a kind of particular model. It doesn't appear that even though the schedule of a middle school matches a schedule at the high school, that the activity of COVID that is moving with kids matches that level of activity. So when I asked the middle school principals this question and said, can you guys consider that we may want to try this at the middle school, in a few weeks, if we can have some success with this with K-5, they completely in agreement said, we would like to try this now instead of the transitioning after a few weeks. And if this does work at K-5, let's just get it going, because the thing that they were expressing at that time, which was last week from today, was the transitions are the things that are just causing us so much grief. And so I think that was the message they wanted to send. Today, I haven't asked since this new data has come up, but I can tell you that they're going to, the teachers I talked to today and the building administrator that I talked to today was that the 4-day a week seems like a good solution at this point. But I think that they would be very willing and open to listening to, if this is just not manageable. It became quite evident when Lake City was getting to a point where the number of cases that were impacting it was causing substantial disruption to the learning. And I don't know that we need to go to that level or that extent of doing this, but that was the rationale for that decision then, was they were like, the transitions are just, we're approaching November, and they just feel like we're just swinging back and forth. And so that's what they were asking for. How about we just dive into this, give it a shot, and see how it goes? Now, since that decision, this data has changed. So
I've got a couple questions, a couple thoughts. One, just in regards to quarantines and number of quarantines, we must be north of 400 probably folks that have been quarantined this time, or 350, I would guess, because we had two something at Lake City. Any idea on numbers of those students that have subsequently tested positive, or are we tracking that data?
So let me start by saying currently, right now, we have 278 people in quarantine. That's as of now. And remember, that's a very dynamic set of circumstances. We've got people coming off of quarantining and going on to quarantining to some extent at all levels of this. I think we do have some data, maybe, that we've got most recently on that.
Chair Marisro, members of the board, Superintendent Cook, I can tell you that there are a number of students who have tested positive after being notified to quarantine. I don't have an exact number for you, so it would be a ballpark number. 20 or fewer.
Okay.
And I guess in relation to that, I would like to express that at the high school level, we have not specifically identified any students or staff that have that we would regard as in-school transmission. With the activities of high school students and adolescents, it's very difficult to determine where their exact exposure occurred. And that is one difference between the younger children and the older students, is the jobs, activities, and large group gatherings that they participate in after hours. And so there's quite a bit of overlap when we're doing that contact tracing in those out of school hours and exposures. And so I would like to relate that those students that I'm estimating at are 15 to 20, that those students we do not believe to be in school transmission, although they were identified as close contacts.
That's great news. And since we have you here, Nicole, can we thank you and your team for all of your hard work? I know this contact tracing is taking a tremendous amount of time, so it's with gratitude that I thank you. So
Thank you.
I think for me, a couple things, I think board, you guys saw it, but I was like, I need to look at our data and say, okay, what are our cases and how do they look at K-8 and high school? And so I threw some of that data into a chart and, I think overall, without kind of boring us with math that took me way too long to figure out, oh, they threw it on the board there. They threw it on the screen. So there's 3 lines there, and the red line is our K-8 trend, and that's on a 7-day average of staff and student COVID cases. The top line, the black line, is our high schools, and the blue line is the district as a whole, the line in the middle. And so, for me, I need to see a picture form of it, I guess, as opposed to looking at our data dashboard that we have on the district website. And that's where I got the data, and I'm not privy to all Nicole's information, so it's probably not perfectly accurate. But, a couple things stood out to me. And my numbers differ slightly than what Dr. Cook said, but, at K-8, that makes up 2/3 of our population. They accounted for less than 1/3 of our total cases. Which was around 19 is what I had. And then I had secondary in the 40s. And at less than 1/3 or about 1/3 of our population, they made up over 2/3 of our cases. And I've thought a lot about that and why is that and how is that? And really we hadn't had middle school cases till this week, we picked up a few this week. And I think, part of that is our mitigation efforts in school. I think it's the cohorting, it's the mask wearing. I think it's our littles are more cooperative. There are less social interactions outside of school, those sorts of things. And I think middle school probably falls somewhere in between there. They're certainly don't have the free reign that high school students have when it comes to leaving campus or social interactions and those sorts of things. And so, Ms. May, I understand what you're saying and what the concern is, because middle school, we are not cohorting them or social distancing in a full in-person model. But we also haven't seen significant cases at the middle school, and that could change, right? In the last couple of days, we've had 3 cases. 4 of the 3 cases happened in the last 2 days. So, that's a hard one for me. I certainly 100% support our decision at K-5 to maintain the 4-day school week that we presented, or that Dr. Cook presented and we approved on Monday. And I 100% support our high schools in the hybrid model right now. And I think middle school is the one I'm conflicted with. I kind of feel at this point for me, because of the limited number of cases we've had, that I would be comfortable forging on with a caveat that if we see an uptick, that we react to that and that we move middle school. The other thing I think that was interesting for me in this data is if you look at the blue line, the district as a whole, and that's it's the average number of cases per day if we had 100,000 people in our school. So that's why the numbers are kind of big. And I did that because that's often how this data is looked at, is per 100,000. But if you look from the start of that chart is September 27th, and that's really when we started to see cases in our buildings. And that's why I charted from that date. It's been pretty consistent as a district as a whole, as far as the number of cases, or reported cases, of course. And in that time, we've seen significant increase in the number of cases in our community, doubling weekly. Yet we haven't in our buildings. And really, I think, I couldn't tell you why that is, but that, I guess, weighs on me in my decision-making, that we haven't seen the significant increase in our buildings. And so I'm willing to give middle school a try to keep it at 4 days, because it is a critical age. I think it's a critical piece. I certainly understand your concerns, Ms. May, and I think if we were to go that route, either we're on speed dial or we give Dr. Cook some authority there, which he has because he exercised it with the high school, but that we convey to him if we see a situation arise at a particular building or the middle schools as a whole, that we would react and move them to hybrid. That's where I'm at, I guess.
I would say I'm similarly situated. I am concerned to have seen the trend up the last couple days. I felt much better on Monday when we made that decision. But I'm also inclined to want to hear from our admin. If Dr. Cook's in the school and teachers are talking about the connection that's happening and being able to get to kids, I think their input is important before we made any kind of change. I think it's our obligation to maximize our in-person learning when we can, and I don't think we're at a critical stage like we were at the high schools. And weighing the quality of education kids get and their mental health with the transmission happening in our schools is what I think this board is somewhat morphed to, as opposed to looking at community-wide, because I do think our obligation, while there is some to the community, it really stems to our students and our teachers. And I think Casey has done a great job of outlining and articulating in somewhat of a graph form how somewhat stable our schools have maintained and been through some really dramatic increases. And so I wouldn't be inclined to change the decision we made on Monday today. But again, I felt Dr. Cook made a great call last Friday, and I think that kind of call can be made again if we get there, or this board convenes and looks at those numbers and makes that call at the middle school level if we needed to.
And sorry, Tamara, just real quick, Trustee May, you mentioned transitions and how disruptive they are, and Dr. Cook did as well. And I think they are, and I'd love to see us stick with the plan and be with the plan. But we're moving to our 7th week of school next week, and it'll either be our 4th or 5th schedule, depending what we do in 7 weeks of school. And so, I think if we're going to be flexible and we're going to be creative and try to get students in class as much as possible, we're just going to have to ask our community to bear with us there. And I think for the most part they have. But obviously it is a painful transition, and I think we want to minimize those.
Could I point out then as well, just since you just said that, in the last 3 to 4 days, additional information from, and we've mentioned these all, but I want to list them. The CDC has given us new information for exposure and contact tracing. The Idaho Board of Education has changed their reopening plan. Panhandle Health has made 2 different significant changes. Kootenai Health has called out for help and has made significant number of changes. And we've also received information from the Spokane Health Department regarding Dr. Letz's information and classroom transmission. And so for all those folks that we keep hearing from regarding transitions, we're receiving new information constantly, and we haven't even had a chance to process that. And so I, like the rest of us, want to get to a spot where we're consistent, but we're not fully there yet. And so I want to encourage our community and our teachers and our parents to hang with us, because things have changed. We've heard a lot this week. Why aren't you doing what you said you were going to do? Well, because what we said we were going to do has changed radically, and changes even within the last 3 days. So
I was just going to say that I was comfortable still moving forward with the measures that have been put in place and have been done very well at all of our schools across the board. With what we decided on Monday, trying to keep kids in school in person as many days as we possibly can, but with the option of looking at, school by school if something were to flare up, say at Woodland Middle School, to, you know, have the option to do what we did with the high schools and move back to the original orange hybrid. So that's just kind of how I'm still feeling confident and comfortable with our numbers in the high school, and with seeing that I believe there's only been one, if I'm correct, with our information we've been given, that's taken place in school, and most of the transmission has happened outside of school. So anyways, that's kind of where I've been leaning on this, and just thank you guys and the schools for doing a great job.
Dr. Cook, I would feel, and the rest of my fellow board here, I would feel more comfortable maybe with a stronger sense of data points, both at high school and at middle school, of what that means. If we're getting close, it doesn't, a range again, so that parents and teachers can know, okay, there's 10% of our middle schoolers are beginning to rise up. What are those trigger points?
So let me address that. This is actually more of a challenge than it would appear to be. I asked that very specific question to the epidemiologists, and it's a little bit like calling a snow day in the regards that there are a lot of moving pieces. And so for this one, I asked, and the example they gave me was like measles or flu. Was 10% what raises their eyebrows, 30% is when they're going to take some action. And so I asked quite frankly, so are you telling me that 30% of our kids being impacted at a school is through quarantine or through positive cases or absences? They were actually hedged off of that and said, no, what we're actually saying is that number when kids can't participate in the learning experience is when they get alerted. And so for them, they see quarantined kids as still being able to participate. That being said, I do think that we're talking about a substantial impact when you talk about a third of the kids either being in quarantining and participating online, because our teachers will be the very first to tell you that teaching 15 kids or 17 kids in this class and then teaching these 10 online together that's a challenge. And so I think that's quite frankly what, and in 10 years from now, maybe history will look back on me and it was a terrible decision or a terrible mistake. But I think that's kind of the environment that we're tending to look at, is what are our abilities for our kids to participate? Or the other action that could very quickly warrant that is the adults that are being pulled out of the schools, either because they're absent, because they're sick, or because they've been quarantined. What is our ability to deliver upon those commitments? I'll be quite frank with you, we are struggling with subs. We aren't having the most luck, and I think we probably get as many subs as any district in the region, and it is a challenge. It is a substantial challenge. And so if there comes situations when we may not even have anywhere near those numbers of kids being excluded or participating through a quarantined kind of network, but those teachers are missing, or we don't have adults that could fill those seats, that action could happen at a much earlier event.
And Dr. Cook, just to add to that, and Nicole might be a good resource, I think it's important when we talk about 30% absentee rate, that's under situations where we're dealing with things like measles, mumps, rubella, whooping cough, where we have vaccines and we have therapeutics. This is a pandemic with no known cure or therapeutic, unless you're getting remdesivir, and no vaccine. So it's a little bit different, and so I think remembering that, and that this isn't a playbook that we've used in the past. And whooping cough, we can isolate it, we can treat it, we can we have therapeutics. This is different, and I think that's why it's unnerving for our staff. And so I would just like to acknowledge our staff, and I think especially at the middle school. I'd like to hear from them before Monday, our administration and our middle school staff, how they're feeling about that, making sure that they feel safe in their classrooms without social distancing. If there's anything we can do to assist them, that would be nice to know.
Yeah, I think it's a very fair and reasonable point. There isn't a playbook for this, and there isn't a quick and easy answer to those points, and that's the challenge. That is absolutely the challenge.
Ms. May, I don't want to make an assumption there, but was I kind of hearing you're okay maybe moving forward with the plan, but that obviously we're meeting again on Monday, and then we discuss this, get some input from our admin, and is that what I heard?
No, I think,
Sort of,
to be
or-
honest, I respect everyone's decision. I feel as though we made a commitment to our community that we have very few resources available to us, and social distancing is a key point. And so when we talked about K last year or last week as a group, I was very excited because I didn't recognize that in 7 days the environment or the landscape would change so dramatically. And I'm worried with stats like an 18% positivity rate. I think there's great risk, and we are actively experiencing community spread. And so I'm not sure it's the time that we have students sitting in a classroom shoulder to shoulder. So I would prefer that our middle school students learn in a hybrid model until we can make a turn and we see cases decrease or our positivity rate decrease. You know, we mentioned Dr. Lutz in Spokane, and there was a story in NPR and the Wall Street Journal talking about the importance of students being in school, and I wholly support that. But under these models, they're talking about opening schools, putting students back in the classroom when we're talking about positivity rates of 5% or lower. And so unfortunately, our community is not in that position. We don't have the luxury where we're up to speed on contact tracing. Panhandle has mentioned that they're feeling overwhelmed. That's why I'm fortunate we have Nicole and her team to be doing our own contact tracing. But right now, we have widespread, uncontrolled community spread. Our hospital is asking for our help. And so I don't feel as though it's prudent that we're putting middle school students shoulder to shoulder. And I respect everybody's decision here tonight, but I think we need to watch closely, and I'm worried about an additional transition in the coming weeks. If we're not successful, then we're again pivoting an at-risk population that transitions hard. And so right now they've gone from hybrid to 5 days a week. And so if we do the 4-day-a-week model and we have to pull back in a week, you know, in just 1 week we've seen acceleration. If we see another 100 or even just 50 kids quarantine next week at middle school, that's too many to be sitting at home alone for 2 weeks. And so I worry about that. So while I respect everybody's decision up here tonight, I'm really not comfortable having our middle school students not in a hybrid model. And I think Post Falls, you know, made a strong move today. They're moving to a hybrid model until we can get this under control. And I think at elementary it's different, and I've acknowledged the differences between elementary, middle school, and high school. And I just view middle school closer to high school as far as transmission and social behaviors and activities. And so I think that's why I have pause.
Question real quick on how close are we to working on, I know we are working on when kids get quarantined for 14 days. If between day 5 and 7 they're having no symptoms and they get tested and they have a negative test, they can return to school. How soon do you think we'll see that, or what does that look like?
Yeah, I'm glad to take that on, Trustee Pickford. So on Wednesday, we submitted a policy to local pediatricians that would potentially, well, actually, I'll back up a little further. Last week, I sent a letter to them suggesting this is something we were pursuing. Is it a pathway that they felt like they could get behind? And quite specifically, it was in a window of time between day 6 and day 8 for an asymptomatic individual who is exposed. So somebody identified as a close contact. If they could take a PCR test, pass that test in that window, that 6 to 8 days post-exposure, pass that test administered by a healthcare professional, could they return to school during that time? So it would be essentially, let's just say 7 days, for example, is the day that they tested, they got a negative test. Could they return with some enhanced non-pharmaceutical interventions for that window of time between the 7th day of quarantine and the 14th day of quarantine? Could they return to school and participate in school in some fashion? And we sent that out to them, the letter out last week. We sent the policy out after some feedback from them. We got some feedback as late as Wednesday and yesterday on that. And so we have now had one group of the pediatricians say that they can support this completely, and we have yet to hear from a couple of others, but we've been in contact with them, but they haven't given their thumbs up. If we can get that done here very quickly, we would have that. Right now it's noticed to be on the board meeting for Monday. And it does appear that generally people are receptive to the idea, which would be a fairly substantial decrease in the amount of time that students would be expected to be out. If we would then present that to the board for your approval. If that was a consideration that the board found amenable, then we could then enact that policy so that in that window of time between day 7 and day 14, students could be back participating with some limitations. It's not a, you're back in school like we forgot this. We would still be monitoring some things, and there would be some limits.
Yeah, again, Dr. Cook, I'd like to thank you for taking the lead on this. It's a huge step for our students and our families, and it's too bad you didn't have guidance at a state level or a federal level. So I appreciate your work on this. It's huge, and I look forward to hearing back from the rest of the pediatric groups that you're waiting for.
Okay. Ms. Smith, did you want to weigh in there at all on, I guess, moving forward? Is that what we're doing for next week? Because we're moving forward with what we decided on Monday, which would be the 4-day for K-8 and the hybrid for elementary, or excuse me, hybrid for high school.
Yeah, and I think where I'm at is very similar. If you take all the pieces together, I'm comfortable with where we're at for high school, K-5 for sure, and I'm conflicted at the middle school as well for all the reasons that we've already talked about, and I am most conflicted about the constant change for those parents. I wonder, and those families and those students, I would like to see more feedback from teachers specifically. That would be where I'd want to be. And so I think moving ahead at this moment with where we're at, and then getting more feedback.
Okay.
And I hear everything that Miss May just said, and I want to value that a lot.
Yeah, I think it's important, and I think we watch the middle school carefully, and we asked Dr. Cook and Nicole that we're watching middle school carefully, and if changes need to happen, they happen. If the circumstances change, just like you exercise that authority with Coeur d'Alene High School in Lake City and Venture High Schools a week ago.
Chair Marshall, if I may, after some feedback, I would mention that Venture High School felt like, with their small size, that they could align much more effectively to the 4-day a week, and so they're going to try that pathway, and just as we would with any school, we're going to watch that closely and just see how that goes. So they would be in the 4-day a week model with that Wednesday remote day as well. So when about 150 students, I think, it gives them much more flexibility with regards to class size for them to be able to monitor that. So I think that's a slight change. At one point, we were hybrid across all three, and then as those cases have subsided at Venture, that they feel like that might be the best path forward for them to go right now. And so we would support that as well. And that's I think, at least at this point, where we would ask that be considered as a current kind of status for them. So
I think that sounds excellent for Venture, so happy to hear that. Before we wrap up today, I don't know, I felt this was important to be said and for me to say it. I think it's been weighing heavy on me, and it's certainly been an interesting time to be a school board trustee. I think we've all felt that. And I think for me and my colleagues, these last few weeks or months have been some of the most stressful and challenging of our lives. And unfortunately, we have the unenviable position of being the last man standing with no one left to pass this hot potato to. And whether that's from the governor to the state board to county commissioners, public health districts, mayors, they've passed this potato and stuck it with us. And that's the burden we'll have to carry, and it has been a burden. And so locally, it can feel like we're a little bit left alone, and I know that isn't the most comfortable position for us. But I'd say if you've been by our schools, you know that our students and our staff are taking the necessary safety precautions of masking, distancing, and hand hygiene serious when they're in our care. I'm sure you're also aware when they're outside of our walls and fences, people have let their guard down. We need your help, and our businesses need your help. Our children can't afford another shutdown, and we don't want another shutdown. Our businesses cannot afford a shutdown. I am begging, and I'm sure my colleagues are begging, our civic and business leaders in our community to come together and take the necessary precautions so we can get back on track. We don't have to look back very far in our past, and Dr. Cook referenced it earlier this past summer, but we saw a very similar rise, a rapid rise in cases, followed by more diligent use of masking, distancing, and hand hygiene. And that improved our situation. As a community, we've let our guard down. And if that's the path we choose, then that's the path we choose. But that will be the community's decision when schools are closed. So we're begging you, please help us practice these simple safety precautions so we can keep our kids in school, so we can keep your kids in school. So, please. Okay.
I appreciate that, Casey, and I 100% support that statement. And I know that there are some other school districts that have put the same plea out to their community members, and it is very much, in many ways, out of our hands if we don't get it under control to make sure that kids stay in school.
I think if our second graders can gladly wear masks to school and do so out of the care and concern for their teachers, I think our community can serve one another in doing so as well, and to practice all the things that we can do to stop this from continuing to get out of hand. And we need everyone to make those steps.
Okay, thank you. If there's nothing further, I'm going to go ahead and adjourn the meeting. I want to thank the folks who came here on these treacherous roads to be with us today. We had around 400 or so, give or take, online, kind of bouncing in and out. So thank you for spending your Friday evening with us. I'm sure we'll get a message out to the district, just to our district families, just to clarify what the board talked about tonight. And thank you all for your time and your patience. And have a good night.